From apologies.
I apologize to her for what she had to go through, that she's a rock star, she did everything right in this case, and she didn't deserve to be arrested for what she did.
To condemnations.
His actions were out of line. There absolutely no tolerance for that kind of behavior in our hospital.
The University of Utah Hospital and police talked about what happened when nurse Alex Wubbels was arrested by a Salt Lake City police detective on July 26th. The disagreement, officials have said, came down to interpretation of policies, procedures, and the law in whether to hand a blood draw from an unconscious patient over to police.
They were under the same impression the officers from Salt Lake City were, that they had implied consent to do that. Now, in hindsight, we all know that that's not the case.
Alex Wubbels stood firm and upheld hospital policy.
The hospital says top members immediately met the next morning and came up with a new plan.
Number one, the nurses do not interact with law enforcement.
Instead, police will only interact with supervisors. Number two,
we will never interact with the police department on a patient care area. This is never acceptable, and if there's a discussion or an issue, it needs to occur outside the patient care environment.
All in an effort, they say, to make sure police and hospital staff never come close to this kind of situation again. Now, the hospital says they came up with that new plan the very next day after Nurse Wubbels' arrest, but it wasn't implemented, fully implemented until about 2 weeks later. They said that the day she was arrested, supervisors did jump in to get Nurse Wubbels released, and she was never charged in the incident. Live at the University of Utah Hospital, Lauren Steinbrecher, Fox 13 News.